Monkeypox cases multiplied this month in Champaign County. Public health officials counted 2 total cases up to mid-August. In the last 2 weeks, that number jumped to 10, making Champaign County the downstate hotspot. Our investigative reporter Renee Cooper is live in our newsrooms tonight. So Renee, is there any concern for a rise in cases as thousands of students return to U of I?
Well, Jessica, the University Health Center director expects there already are more than 10 Champaign County cases of monkeypox, or MPV, as health officials now prefer. The same goes for the surrounding counties that are not reporting any cases at this point either. The director says there's an explanation for that and for why there's been 0 cases among students so far. But he expects that to change any day now.
So yes, there is a high risk level in the student population.
As the director of the University of Illinois' McKinley Health Center, Awais Vade sits at the helm of responding to and mitigating MPV at the state's largest school.
I'm not, as much worried about interactions in the classrooms.
The bigger concern is the time spent in the dorms or at other social events.
And especially in those events where clothing is minimal.
Still, no cases have been reported in the week since students returned.
The students over there were actually very conscious about the fact that they don't want to be very close to each other. They really want to experience campus life, and they don't want to be, in a situation where they have monkeypox or COVID, and they are now in isolation with MPV, it could be up to 28 days.
Vade was a familiar face in the Champaign County COVID response as the public health deputy director. He expects MPV cases are underreported at the university, county, and surrounding county levels.
I know that the hospital system is testing, I know public health is testing, and I know that McKinley is testing as well. But in many other communities, you don't have the resources or the expertise to test as well.
Vade says there's another barrier in people choosing not to test.
In my opinion, a lot of individuals choose not to test because they don't want to be associated with MPV as a stigma. This is not a sexually transmitted infection, and it is not an infection primarily of men who have sex with men. Anybody can get infected with MPV, as we have already known.
Now, one of those destigmatization efforts is the move to calling the virus MPV. And although it's been around for decades, health officials are still learning about it. Recently, the CDC updated guidance on how it spreads, including by touching fabrics and surfaces used by someone who is infected. Vade says long sleeves and pants can really reduce your risk. Although Vade estimates 95% or more of cases develop after close skin-to-skin or sexual contact still. Live in the newsroom, Renee Cooper, WCIA3, your local news leader.
All right, Renee, thank you. Vaccines are available to U of I students at the McKinley Health Center. U of I just received 400 doses from the state. Those are recommended for higher risk populations, including those who have been exposed. Champaign-Urbana Public Health has between 1,500 to 1,900 doses. Those are also reserved for those at higher risk. Monkeypox cases are climbing in Illinois, and now public health officials and LGBTQ+ advocates are combating stigma and misinformation. They say it's been hand in hand with the virus since the start of the outbreak. Our investigative reporter Renee Cooper is here. Renee, the LGBTQ+ community, particularly gay men, have been called higher risk for monkeypox.
Well, Jessica, the focus in initially responding to the virus was where the first cases were reported, and they happened to be in men who were in sexual contact with other men. And as an epidemiologist explained to me, any disease then spreads among a social network. But he made it abundantly clear that was happen chance. Anyone can get monkeypox, and no demographic factors make anyone more susceptible than anyone else. Now, the director of operations at Champaign County nonprofit Uniting Pride says reporting of monkeypox has led to finger-pointing and blame of a community that's been ostracized before in relation to illness.
It is really, really important that we be very careful in the way we message monkeypox. Are we seeing higher rates in our community? Yeah, but guess what? Health outcomes in LGBTQ+ communities are worse across the board. We are a marginalized and victimized community that systemically is kept from access.
The more we test, the more we'll do contact tracing, we'll find out that there are a lot more communities and demographics that are being affected.
Now, both the epidemiologist and Uniting Pride leaders say marginalized communities are always adversely affected because resources are simply more limited in those communities. Avais Vade, the epidemiologist and U of I Health Center director you saw there, says the misplaced stigma is also keeping people from getting testing, something that's critically important to getting ahead of future spread and developing data needed to learn more about the virus that can be caught by anyone in more ways than one. Jessica, back to you.
All right, Renee, thank you.